You denied a $539 inhaler. A 22-year-old had to choose rent. And as a result, he's dead. This is Aaron from Social Work. I'm calling about case number 774589. Yeah, this is a 22-year-old. He was denied the inhaler. Yep. Well, I'm calling to let you know that he's not going to need that anymore. He made the choice that he was going to pay his rent, like most people, and unfortunately, he didn't make it. He died. He had an asthmatic attack because he didn't have the inhaler. He didn't have the inhaler because you denied it, because you were proposing step therapy. You wanted him to fail a couple other more conservative treatments, and that gamble on him failed for him. Yeah, he could have paid out of pocket $539. That was his rent. How would you expect that he was going to make that? Don't say step therapy. You told a 22-year-old to keep struggling until their lungs proved that they deserved help. That's what you said. Look, I'm not calling to argue or fight this with you. I am calling so that someone has to read this transcript back and that it's part of a record.
So you guys are paying for health insurance to not get the insurance you're paying for. Insane. Families should be able to sue for malpractice against the insurance companies. Absolutely. We were not born yesterday. We know what they're trying to do. Why the is an inhaler 539 in the first place? Y'all need to check out Aaron the social worker. He's doing God's work right now.
I don't know if you heard in this peer-to-peer call that I hosted, but the peer that talked to me mentioned that sometimes they make these calls for, quote, planned denials.
But it's like a required call, so it's like awkward because usually like these are because there's going to be like a planned denial.
So that's a new phrase for me. I think we've all suspected that that's what's going on, but to hear him say that some of these denials are, they're planned. It's already set in stone and they're just going through the motions with the peer-to-peer. That was eye-opening, and I think that term planned denial is something that is probably used internally in insurance companies, but rarely with doctors and patients. So the planned denial sounds like they've already decided it's denied, and that's it.
It's devastating to me.
Fighting for his breath, Duran Wells is battling stage 4 lung cancer. The husband and father of 3 is also now battling his insurance company.
I'm really sad that my life is in the hands of these decision makers who seem to make these decisions in such a cold way.
The 59-year-old and his family say Cigna had approved him for procedures that would allow him to be transferred to Northwestern Medicine in Chicago for a clinical trial double lung transplant he had been medically approved for. But Friday, as they were preparing to leave UCLA Medical Center Santa Monica, Cigna denied coverage for both the transplant and medical transfer to Illinois.
The last option we have is for us to take him to Northwestern, period. And I hope Cigna really understands the seriousness of the situation. We're not just a number. They were talking about his life.
They want to save all the money that they collected from him throughout his time he paid, and they didn't want to pay him back for the time he needed it the most. These insurance companies are disgusting. Insurance shouldn't be able to deny a claim that the doctor said was medically necessary. What do the insurance people know about medicine? And Trump thinks Canadians want this for us, our fellow citizens and our neighbors. We want better for Americans. You don't deserve to be treated like this. No one does.
I need someone to explain to me, like I am 5 years old, how it makes sense that a literal doctor who went through undergrad, medical school, years of residency, and is a full-fledged doctor, prescribed my son a life-saving medication that he needs for a diagnosis that he has received, and my insurance gets to say, no, he does not.
Allow me to explain it to you briefly. You see, you live in America. The US is a greedy corporation milking its citizens for billionaires. Man, ain't that the truth? Because the insurance companies bought all our politicians, it should be illegal. But our lawmakers are only there to make money, not legislate. The insurance company that you pay to, like, how is it legal to pay for a service and then the provider says, nah man, we ain't providing that service.
You can't keep getting away with it!
If I pay an insurance company a monthly fee to insure me, and they deny my claim, when my medical professional care team is saying I need said service, how is that not a breach of contract? Asking for a friend, and by friend I mean America.
I'm a doctor that works in the hospital, and the most frustrating part about my job is dealing with insurance companies. Let me tell you about a couple recent cases I had. I was taking care of 2 patients in the same week in the same hospital that had the same health insurance plans. Patient number 1 was admitted with a heart attack, and she subsequently developed acute pericarditis requiring a prolonged steroid taper, and unfortunately, she was severely debilitated. Patient number 2 was admitted with recurrent falls and was found to have pneumonia, severe orthostatic hypotension, among other diagnoses, but was also severely debilitated. Both of these patients had complex medical illnesses. Both of these patients were recommended for inpatient rehab by physical therapy and occupational therapy, and both of these patients had multiple physicians caring for them that agreed with this recommendation. On top of that, both of these patients met the CMS guidelines for inpatient rehab, which are the guidelines that set the national standard for medical necessity. But here's the thing. Both of these requests for placement were denied by their insurance companies. So we had to perform appeals for both of the cases, and then the insurance company required us to do peer-to-peer reviews for both of them. This means I have to drop what I'm doing and call them when they want me to call them to fight for approval for my patient. And of course, when I called, I was placed on hold forever, and when they finally got back to me, they said their medical directors were busy and that they'd have to call me back. I was finally connected to their medical directors. Both of them refused to give me their names, both of them refused to verify their credentials, and both of them assured me that they were medical doctors, and I just had to take their word for it. Both patients met criteria for inpatient rehab. I pleaded why they needed to have their appeals overturned, and one got approved, but the other did not. But here's what gets me. How can they outright deny care when they've never even seen the patient? And there's no way for me to even verify who I'm talking to. How do I know they're even credentialed or the right person to make that call? And we're the ones seeing the patients in real time. We have therapists, case managers, other physicians physically seeing patients and meticulously working on appropriate disposition. How is it that we all unanimously agree on something a patient needs, but some anonymous person on the other end of a phone call has the final say? And you know what? These aren't isolated events. This is the same song and dance happening in hospitals and offices nationwide. This isn't just frustrating, it's flat out dangerous, harmful, and it's wrong.
So the professional is the one asking the insurance company if they can proceed with the surgery and have to justify on how severe and important this is in order for them to pay out. It's kind of backwards when you think about it. Insurance companies in America are broken beyond repair. We need universal care, where access to care is equal for all citizens. For-profit insurance companies are in the business of making profit, not providing care. That's why MA plans are never purchased by healthcare pros. If the importance of having insurance is to cover you during dire situations, then what is the point of them being in business if they're going to deny you the claim all the time? Like, that should be outright fraud right there.
So I had an interesting call with the insurance company today. I had a patient that was scheduled for surgery last week with severe stenosis, motic changes, grade 2 slip, and failed all conservative treatments, and they denied the surgery the day before. And we appealed, and because it was a Medicare spinoff, they actually made us wait a week because they had to go to a medical director. So the guy was left suffering, and the medical director called me back today and said that he thinks surgery should have been approved, but the reason they denied it is because one of the mid-level notes previously said the patient was walking 2 miles a day, and I guess they felt that if the patient is walking, then they shouldn't really need spinal fusion. So it's kind of an interesting dynamic, because on one hand, we want our patients to be active, even the ones pre-surgery. I mean, it does show, studies have shown improved rates of recovery when patients are active, when they're moving beforehand. But on the other hand, from the insurance standpoint, if they don't have documentation that shows that they're basically disabled, it's a negative in terms of getting the surgery approved.
Moral: if you're insured by a Medicare spinoff, good luck receiving healthcare resources.
It's actually so insane to me how broken the US healthcare system is. About a week ago, I was in Canada skiing where I took a bad fall and severely injured my knee. I went immediately to urgent care where I had a doctor come and see me and do an x-ray. They weren't able to diagnose what I had and recommended that I got an MRI when I came back into the US. I incurred an over $2,000 bill from this visit, which my insurance company has already told me they will not cover since this was out of country and out of network. Back in the US, I learned that I wasn't able to go directly to a radiologist despite getting referred from this doctor in Canada, but rather had to go to my primary care doctor first. I went to my primary care doctor, she gave me a referral for the MRI, and I went to schedule it. However, the radiologist said they would not be able to schedule it until they got a pre-certification from my insurance. We're now multiple days out from the accident, the injury. I still cannot walk, I'm in a brace, and have no idea what's wrong. I had my doctor submit the certification through my insurance and just heard back today that this was denied. Insurance said that they will not cover it because they first require I go through a 6-week trial of provided directed care before I get an MRI. Basically, my options now being I can pay for the MRI fully out of pocket or just not figure out what's wrong with me. It's just genuinely so insane to me how many hoops and hurdles you have to get through in order to get the care that you need and to get the coverage that you have, even when you have insurance.
Anyway, guys, let me know what your thoughts are with everyone getting denied. Leave your comments down below and let me know what your thoughts are. If it's your first time to the channel, make sure you like, comment, and subscribe. It really does help the channel. Also, make sure you check out this video. I'm sure you're definitely going to enjoy it. But nevertheless, I will see you guys when I see you. Peace.